Hello, good day from the Lupus Foundation of America, Greater Ohio chapter. I'm Leslie. I'm the Vice President of Operations for the Greater Ohio chapter, and we're looking to get connected with all of you. Today, we are trying something new in order for our chapter to continue its mission during these pandemic times. We want to encourage and continue the mission of providing you with the most up-to-date, accurate information on lupus. We are trying to navigate through these times to figure out what are the best options to get in touch with our patients and our constituents. One thing we will always do is study the course and provide the education that is always needed to our community and public. This chapter is dedicated to funding research and funding local and national initiatives on lupus advocacy. And together we can do that every day. So by joining in on our webinars and our new patient education classes, we are educating ourselves to be the most empowered with lupus information. So as patients wait for researchers and our local scientists to find better medications, a cure, better treatment options, we will continue to educate ourselves every day and learn something new. So the new patient education class is something that we provide monthly. We host 5 new patient education classes in person throughout the state. In light of today's times, we are now forced to work from home, like I am, so there might be a crying baby in the background or a dog running past, but we learn to work past these things. And one thing for sure that I know about lupus patients is lupus patients are really susceptible to change, meaning you have the ability to make great change every day. And right now, currently, we're all making change together. So bear with us as we try to navigate what we can do to still stay connected. And although we're working from home and maybe not able to meet in community settings together, we're finding new ways to connect. And that's why we're bringing you this webinar. So the new patient education class is a class that you can attend. You do not have to be a new patient to attend this class. You can, perhaps you've been diagnosed for years, but have never formally sat down to a 101, what is lupus? This new patient education class is just a stepping stone on the basic information on lupus. Maybe you know someone with lupus and you want to spend the time to learn a little bit more. May is Lupus Awareness Month. And what a great gift to give to another lupus patient to say, you know, I was thinking of you today, and the Lupus Foundation of America Greater Ohio chapter provided a webinar that I sat in on so that I could better understand what you're going through. So if you wouldn't mind, please join me. You can follow along through this video and jump in and out, but I do ask that you watch and help get educated. May's Lupus Awareness Month, as I mentioned again, so let's get the facts and spread the awareness. So let's get started. The new patient education class is a class that we developed with our national organization to help educate patients and their families to live better with lupus. And as I navigate my computer screen, let's hope that I can get everything up and moving. So bear with me. I apologize. Let's see. There we go. So thank you. Why are you here? Many patients have many questions. Some of the times they're left unanswered. So perhaps you know someone with lupus, so you're here to get more information. You want to learn more. You just want to get educated. Perhaps you're recently diagnosed, or like I said before, you've had lupus for years, but just never sat down to a formal class. Chances are you have a lot of confusion, a lot of questions that just need to be sorted out. So again, here is going to be just the basics on lupus. So what is lupus? Well, we know lupus is a chronic autoimmune disease, right? So what does that mean? The immune system turns on itself and starts attacking healthy tissue, healthy organs. Why? We don't know. But what we do know is that the immune system for lupus patients puts out antibodies that attack its own healthy tissue, its own healthy cells. And so that's why it's chronic and it's autoimmune. It turns on itself and starts attacking itself. These signs and symptoms are vague in the beginning, sore joints, extreme fatigue, gross fatigue. And now I'm not just talking about the fatigue that, you didn't have a great sleep. And so if you took a nap, you woke up and perhaps you'd feel refreshed. I'm talking about gross fatigue, where it's just difficult for you to even just reach for that glass of water. You're very tired. And these signs and symptoms generally last longer than a week, from a week to 6 months, and sometimes it happens for years. So we know lupus, something goes wrong with the immune system. The immune system recognizes healthy cells, healthy antibodies in the immune system as foreign invaders and starts attacking it. It thinks they're viruses as such, but they're not. So the autoimmune system builds out these immunities and it attacks. It causes pain, and if not caught early, it can cause damage to various parts of the body. Lupus is known as a disease of remission and flares. We like to tell our lupus patients that remission is your goal. The goal for every lupus patient is to find remission, and it can be done. Some patients might go in and out of these flares where they have bouts where they feel good for a time stretch, and then all of a sudden lupus seems to flare back up and attack the body. If we can really figure out what these triggers are that are triggering the flares, perhaps we can put lupus at bay. Lupus can range from mild to life-threatening, but with good medical care from a rheumatologist, chances with lupus, death from lupus is uncommon. Typically, when a lupus patient, when lupus is attacking major organs like the kidney, the heart, the lungs, is when lupus becomes life-threatening. So who gets lupus? Approximately, there are 1.5 million Americans with a form of lupus. 5 million people throughout the world have a form of lupus, and we estimate that 60,000 Ohioans have a form of lupus. 16,000 Americans develop lupus each year. Most commonly, women are 10 times more likely to develop lupus over men, although men can develop lupus or have lupus. Typically, lupus strikes women during their childbearing years between the ages of 15 to 44. There are strong correlations with lupus and estrogen in women, and so we see that age of 15 to 44 is typically when signs and symptoms are at a heightened peak. Women of color are 2 to 3 times more likely to be affected by the disease. The reality is children, teenagers, men, elderly can all develop lupus. And that's really why we have this rally cry of help us solve the cruel mystery, because it varies. There's no clean-cut cookie cutter saying this is lupus and this is how it presents. It manifests in many different ways. What are the causes of lupus? So this is something that we fight for every day. We fund research and ensure that our local scientists are really trying to get on the cutting edge of lupus research. Scientists are still looking for the definitive cause. But what we really know is that lupus is an environmental factor with genetic predisposition. So something in the immune system is triggered by something external in the environment. And with those things, we believe that it's triggered and causes these lupus signs and symptoms. Lupus in Hispanics and African American. Something that we are all very keen on is lupus research. And what we do know is that lupus affects the minority population much more severe. And we need to figure out the answers on how to help these populations, help these people that are suffering that don't know. And the reality is women of minority are impacted by the disease earlier in life and more severe. The chances of them experiencing kidney disorders are higher, and also having neurological problems such as seizures or hemorrhagings or strokes are more likely in our minority population. So a research study has been done, Lumina, Nature versus Host, to really dig in to see what's happening with our minority population. So this is a great picture of the whole body. What we can really see here, and when we have patient family members come to our classes, a lot of the times you may hear lupus patients say that lupus feels like an invisible disease because you can't typically tell one person over the other who has lupus and who doesn't. I like to think that all of our lupus patients are just absolutely beautiful and you can't tell who has lupus and who doesn't, right? But that also makes it very frustrating for a patient because you can't physically see what that person's going through. You can't see the inflammation that's happening on the inside of the body or the havoc that's happening with the immune system inside. It can be very frustrating for a patient to try to explain what's happening to them. And so sometimes patients feel that they're a hypochondriac, or they feel that their family feels they're making these signs and symptoms up, or people aren't empathetic to that person because they can't physically see the ailments that are happening. And so when I pull up this picture, I say, does it take us peeling away the layers of the skin so that you can see what's happening on the inside of the body? The reality is lupus can affect any organ, any system in the body. And that is shown in this picture here. So when lupus patients complain of headaches, these are mild forms of what's happening, constant headaches, low-grade fever. They can become depressed. A lot of patients that I've talked to suffer from constant costochondritis, inflammation within the lining of the cartilage, or they've been diagnosed with pleurisy. These things come up and they can't seem to figure out what's going on, and they go to the doctors and they go to the emergency rooms, and it takes putting all these puzzle pieces together to figure out what's going on. Oops, I just want to go back here. Losing my train of thought. Bear with me as we go live here. So it takes an average of 6 years for a patient to be diagnosed with lupus. And in that time frame can be very frustrating for a lupus patient. 6 years is a long time to figure out, am I making this up? Is it in my head? These questions are coming up for people that are suffering, and it's just not fair. And so that's why the Lupus Foundation is here to let you know that these signs and symptoms that are happening are real. And it takes a skilled rheumatologist to help you figure out and navigate the diagnosis process. And we'll get to that a little bit further on. The economic impacts of lupus. It's a no-brainer, right? It's expensive to be chronically ill. And the reality is annual costs of medical treatments range from 12 to 62,000, depending on the severity of the disease. So let's be honest, you'll be going to the doctors more frequently, meaning more co-pays and more lab tests that need to be done. Many lupus patients do rely on government services to provide their health care because it's difficult to work when you're chronically ill. If a patient suffers from lupus nephritis and dialysis is necessary, the annual cost of that is roughly about $60,000 per year for a patient. Many of the times lupus patients complain that the medications that are given to a lupus patient can be worse than the disease at times, right? And we'll talk a little bit more about medications later on. But some of the side effects of the medication can cause bone demineralization, and hip replacements are necessary for patients, and that could cost between $12,000 to $105,000. It's very costly to be chronically ill. So today we're going to talk about the different types of lupus. We recognize 4 different types of lupus. The main categories are systemic lupus erythematosus, which is commonly called SLE, cutaneous lupus erythematosus, or discoid lupus, or CLE. We're going to touch upon drug-induced lupus and prenatal lupus today. So systemic lupus erythematosus, SLE. So with SLE, systemic meaning the whole body, the whole system, it means it can affect any organ, any system in the body. And the way that it's diagnosed is through medical history, extensive medical history, I should reiterate, examination, extensive examination. The medical history is so important. As I had mentioned when we were going over the picture of the body, these signs and symptoms come in sporadically, and no two patients present exactly alike. Some develop later in life, some develop earlier in life. The symptoms never are XYZ. They manifest in different ways. So making sure when there's something wrong, you're reporting it to your physician so that there can be a trail of what's happening to your body, to you as a patient rather, and that these signs and symptoms can be lumped together and finally given a referral to the proper doctor to help treat and diagnose you. So again, extensive medical history, extensive examination, extensive lab tests, and specialized diagnostic tests with LabWorks. There is the ACR classification criteria system that is a tool used to help in the diagnosis of lupus. So with SLE and diagnosis, patients usually present with these symptoms. 55% of patients present with arthritis or arthralgia. Arthritis is painful swollen joints, and arthralgia is just painful joints, no swelling. So again, there's the pain without the visibility of swelling. 20% of patients will have some sort of skin involvement, rashes or lesions that can appear on the body. 5% of patients present with nephritis, meaning kidney involvement with lupus, 5% fever, and 15% other manifestations can play a part with symptoms that present when diagnosing lupus. So these ACR classification criteria system is an 11-class criteria, and rheumatologists use this classification criteria system to help in the diagnosis of lupus. And what they say here is that a patient has to have 4 or more of these symptoms for a rheumatologist to really dig in to see, is this lupus or is this something else, right? And so this classification criteria system was actually developed in 1982. And of course, it has been revised many times and looked at. It is still a great tool to help in the diagnostics of lupus and figuring out if a patient has lupus or not. But the reality is 1982, that's a fairly old classification criteria system. So something that the organization really fights for is finding better diagnostic tools to help our physicians identify lupus sooner and quicker. Not that there's anything wrong with this classification criteria system. It is still used today, but there have been revisions, and we'll go over that. But just really quickly, malar rash, that's a rash across your cheeks, across the bridge of the nose, generally sparing the nears of the nose. Discoid lupus, that is coin-like lesions that can develop anywhere on the body. Photosensitivity, so sensitivity to light. Many lupus patients suffer from oral ulcers. Arthritis, serositis. Serositis is inflammation around the lining of the heart and lungs. Renal disorders, neurological disorders, hematological disorders or blood disorders, immunological disorders, and anti-nuclear antibody, that ANA. And as many lupus patients hear, that ANA is a big term that you quite frequently hear. The ANA is not a test that says, yes, you have lupus or no, you do not. It is just one of the tests that is needed to help in the diagnosis of lupus. So I want to reiterate that a positive ANA does not necessarily mean, yes, of course, this is what it is, but it definitely helps in the diagnosis process. So the revision to the classification criteria system. There is a new 17-class criteria associated with the diagnosis of systemic lupus. And so it's actually in the next slide, all the classification criteria systems. But what does this really mean? So as I pointed out before, the ACR classification criteria system was developed in 1982, and there have been other tools that have been looked at. So this select classification criteria system was developed with a group of rheumatologists and scientists to really look at the data and see that there is more clinically relevant information. It reflects new knowledge that we have today about the immune system. It includes up-to-date and more inclusive variable data that need to be looked at. And it helps overcome the concerns of just having old criteria. It should be emphasized that the SLIC classification criteria is, not a definitive test again, but it does help in the diagnosis of lupus. So what are we looking at here? So this is all that's derived. So again, you can see here that all of the 11 class criteria is still on this new classification criteria system, but we're looking deeper into it. So non-scarring scarring hair loss is one of those criteria. A lot of people suffer from a little bit of hair loss that happens with lupus. Generally, I've talked to a lot of lupus patients, and when they do suffer from some hair loss, actually some of the medications can help build the hair back in. And a lot of patients that I talk to have all said that their hair's actually grown back. It's just been a little bit different. And then also with that, some patients can wear wigs to help them feel more confident if there are hair losses. And so if you're suffering from hair loss and are thinking of ways to overcome, or we can always talk and help you out with that. But again, so we digress back to the signs and symptoms here. Really what we're looking at is more extensive lab works, right? So leukopenia, is there abnormally low white blood cell count? Thrombocytopenia, is there something off with the platelets? Elevated ANA, as we had mentioned before, the elevated dsDNA. So it's really looking into more lab works that need to be ran to help in the diagnosis of lupus. So this is something that the SLIC classification criteria system is helping physicians to dig in and give a pathway to help a patient be diagnosed with lupus. I'd like to say that we're cutting down on that window of the 6-year time gap of a patient waiting for diagnosis. And so when we have the right tools to provide, it can only help a patient out by utilizing these tools with their physician, that are available to the physician, I should say. So treatments for lupus. There are many therapy treatments that treat lupus. Unfortunately, many of them were not developed specifically to treat lupus, except for one, and we'll talk about that. But treatments do depend on the severity of the disease overall. But common medications lupus patients take, one is prednisone. Many patients have heard of prednisone. It's a steroid. It's effective, but unfortunately it does have many side effects. So a couple things to take precaution to with the use of steroids is that you have to get your bone density tests checked routinely. Some patients complain of weight gain. The medication itself needs to be taken as prescribed. And typically when a patient is taking prednisone, they start on a large loading dose and wean their way down. So one thing to be very mindful of is if you start prednisone under the recommendation of your physician, and you start feeling a little bit better on the medication, some patients might stop taking the med because they want to save it. These are things that we want to be very cognizant of. The medication you're taking is working because the physician has prescribed a dosage that they want you on, and slowly they'll wean you off. So the goal for a lupus patient with prednisone is to typically, they start on a high dose and they typically wean themselves off until they don't have to take it anymore. Another thing with prednisone, hair growth is a side effect of prednisone. I did mention bone demineralization and not to abruptly stop the medication and to take as prescribed. So hydroxychloroquine or Plaquenil, this has kind of been a hot drug out there right now, but has been used for very many years to treat lupus. It does help treat skin lupus and decrease flares, prevent flares. Hydroxychloroquine is an anti-malarial drug. It's a very old drug. And the reality is hydroxychloroquine has saved very many people's lives. Prior to the medication, lots of lupus patients were seeing unfavorable results, but now with proper treatments, we can look forward to a better life with lupus. So with Plaquenil, a couple things to make mention of is, unfortunately, if you smoke or others around you smoke, it's actually denaturing the medication. It's decreasing the half-life of the medication. So one, I highly encourage you to just practice healthy habits. And if you do smoke, maybe join a smoking cessation class and figure out ways to just get on the healthy track there. and also along with just secondhand smoke. The carcinogens in cigarettes are really affecting the medicines, and overall it's just bad for the health. With hydrochloroquine, it does take about 6 months for the medication to build up in the system. So sometimes I hear patients say that they've been taking the medication for a month now and don't see any effects. Well, truthfully, it takes about the medication 6 months to build up into the system to have that constant level of medication within the bloodstream. So again, this is another medication that you want to take as prescribed. If you're unable to take the medications as prescribed, this is a conversation you should have with your physician on the difficulties or maybe the education as to why this needs to be done a certain way. NSAIDs, non-steroidal anti-inflammatories. These are medications such as ibuprofen, naproxen. These are pain medications that patients use. And so this is really the type of medications that patients should be on to treat pain. When we get into heavier medications like narcotics, although it can help pain as needed, it does not help the long course of chronic pain that patients suffer from. So truthfully so, NSAIDs are really the type of medication patients should take to help ease the pain that they're experiencing. With that said, we also have to be mindful of when taking NSAIDs to remember to protect the lining of the stomach. So some complications with NSAIDs could be stomach ulcers, and we want to be careful with that. So a way to avoid that is to make sure to take the NSAIDs or pain medications there with a little bit of food. Aspirin, many lupus patients are on aspirin. That does not mean if it is not prescribed for you that you should start that course of regimen. That is between you and your physicians. But what we do see is that many lupus patients take a baby aspirin, like 81 milligrams a day, to help just with thinning of the blood clots, to help protect good blood flow. And again, do not start any aspirin regimens without consulting your physician first. Benlysta. I used to say it's the new kid on the block, and I suppose it still is the new kid on the block because patients had to wait, unfortunately, over 52 years to see a medication come out on the market to help treat lupus patients. And to be honest with you, Benlysta or belimumab is the only medication FDA approved that was specifically created to treat lupus. With that said, there are many caveats to Benlysta. It is not a medication for all lupus patients. And we'll talk a little bit about what Benlysta is on the next slide, but it is a common medication lupus patients are on. Overall, non-medical therapies such as including rest, limiting sun exposure, and appropriate physical activity is necessary in the treatment of lupus. And so I should have talked about this with remissions and flares. You know, common triggers for lupus patients can be different for everyone. Just because some triggers one patient doesn't mean it will trigger all. But sun exposure, there is a big risk factor for lupus patients. What we do see is and know is that the UV light in sun actually affects lupus patients on a cellular level. It actually aggravates the B cells within the body, causing fatigue, flares. It doesn't always have to be a rash that appears. It can be, but you'll notice that, or patients may notice that perhaps they spent a long day gardening and maybe they didn't use their protective gear such as sunblock, long brim hats, long sleeves to help exposure to the sun. Perhaps the next day they might feel a bit more fatigued and a bit labile because of their extended exposure. So again, I just want to reiterate, it doesn't mean that a patient has to be recluse from the sun, it just means they have to limit their exposure. By all means, no tanning beds for a lupus patient at all whatsoever. Besides the fact that UV light can be damaging to the skin for everyone, it actually can exacerbate a lupus flare for a patient. The use of appropriate physical activity. I'm a super big advocate for stretching, walking. In the office, you might frequently see us stepping away from our desk to take a nice big stretch just to get blood flow going. And I encourage lupus patients to make that a typical part of their day and routine, especially now when we're kind of stuck at home. Keeping moving can create great blood flow and give you actually more energy than you would actually think. So those are some great non-medical therapy treatments that you can do. So here we go, Benlysta or belimumab. So what it is, it's actually an infusion. It is a monoclonal antibody, which is a super fancy word, as what it means is it's a synthetic antibody that is actually given to a patient. This is an IV infusion. Patients go to an on-site location where an IV started and an infusion is given. Typically, what we see is a lupus patient will go to the facility. In the beginning, they kind of get the medication for a month straight every week, and then they go for an infusion about once a month after that. This is a fairly new medication, which is why I made mention that I used to call this the new kid on the block, which it still is, but it was developed March 9th, it was put onto market, approved by the FDA March 9th, 2011. And we all remember that day in the office when the medication was put out there, because it was a big triumph for lupus patients that had waited a long time for better medical treatments. So with that said, Benlysta is not for everyone. If there are renal involvements or central nervous involvements, it's not a medication that's specifically recommended for patients with renal or neurological issues, central nervous issues. But with talking with your physician, that's something that you could talk about if you are a candidate for this medication and talking about the signs and symptoms. Typically, Benlysta is more for the severe forms of lupus to try to get that under control. So again, Benlysta is a synthetic antibody that's given as an infusion. And what you typically see is that Benlysta is given into the bloodstream and adheres to the B cells in the body. So basically that's what lupus is in essence, is an overabundant amount of B cells in the body. And Benlysta binds to those B cells and helps calm them down. And that's in a really, layman's term there. But these monoclonal antibodies is what's trying to put that lupus flare or that activity at bay and calm them down. If you'd like more information, typically I hand out packages of information that you can talk with your healthcare provider about. I'd be happy to provide that list of facts to maybe talk to your rheumatologist with. So that brings us to cutaneous lupus erythematosus, or CLE. With cutaneous lupus, it really only affects the skin. And unfortunately, yes, some patients with cutaneous lupus have systemic, and typically, some individuals with cutaneous lupus, about 10% of them will develop systemic down the line. But symptoms usually include rashes, lesions, unfortunately, hair loss, vasculitis, ulcer, and photosensitivity. But with cutaneous lupus, it just means that the lupus is just pertaining to the skin at this point. And some patients only have cutaneous lupus. So let's go here. So examples of cutaneous lupus, these are some pictures that we have. The first one here is that malar rash that I had mentioned in the 11 class criteria, is a rash that is kind of in the shape of a butterfly. A lot of lupus patients use the butterfly as a symbol of hope, but what it really is this malar rash is a rash that is generally on the cheeks, across the bridge of the nose. Subcutaneous, these are red raised rashes that can develop anywhere on the body. Discoid, these are coin-like lesions, and I don't know if you can see my mouse here. Well, you can't, but they usually develop in a bit of a circular notion there. So those are coin-like lesions that can, again, develop anywhere on the body. So how is the diagnosis of cutaneous lupus made? I mean, truly, the diagnosis pathway is the same as with systemic. The only difference is a skilled rheumatologist or dermatologist can really look at the unique characteristics of the rash, and also there can be skin biopsies to help to see if there are autoimmune related things going on with it. So that's the big difference, is that you can biopsy skin lesions to see if there's autoimmune activity. But truthfully, physicians are looking at the unique characteristics of these rashes. But again, extensive history, examination, lab works is what's necessary for the diagnosis. So how is it treated? We mentioned before that the sun is a lupus patient's enemy, unfortunately, but what can we do to treat these things? Sunblock, sun protection. Using UVA, UVB sunblock is highly recommended, the highest you can get. The good thing is that a lot of base moisturizers have a general SPF on it, maybe between 20 to 30, which is great to use on a daily basis. But if you're going to be out in the sun, I would definitely recommend putting sunblock and the highest SPF you can get on your entire body, and especially the areas that are exposed to the sun. Topical therapies such as corticoid steroids or injections are used to treat SLE lupus. Some patients are given ointments, topical ointments such as Elidel Protopic. Oral medications that are given commonly to both actually SLE and cutaneous lupus. The first line of choice is the anti-malarial medications. That's the hydrochloroquine or Plaquenil. The second line of choice is the dapazoids, the retinoids. Those are more of the topical. And then the third line of choice is the more heavier medications. They are actually chemo medications. So methotrexate, Imuran, Cellcept, cyclosporin, these are actually low doses of chemo medications. So that goes back to patients saying that sometimes the medications can be worse than the disease at times. Because these medications in the third choice, the line of defense there is chemo medications unfortunately kill the good and bad cells. So a lot of the times patients get confused and the general public get confused because some patients use chemo medications to treat their lupus, that they confuse and blur the lines and think that lupus is like cancer, which is far from the truth. Cancer are bad malignant cells where lupus is an overabundant amount of cells that is fighting its body. So it doesn't necessarily mean that a lupus patient has a bad immune system, they just have an overactive immune system. And so with the third line of choice here, it actually suppresses or kills off the good and the bad. So you get the same side effects that a cancer patient would get. But again, these are very low doses of those chemo cancer medications. Drug-induced lupus. So drug-induced lupus, you know, a big thing that we talk about in the office is that drug-induced lupus, there are 46 culprit medications that are known to induce lupus-like signs or symptoms. A lot of these medications are heart medications such as hydralazine, quindamycin, procandamide. Now these medications, once they are stopped, the signs and symptoms of the disease go away. Otherwise, they go into remission once you've discontinued the culprit medication. And unless you've been specifically diagnosed with drug-induced lupus, and if you have lupus, and unless you've been specifically diagnosed with drug-induced lupus, you probably don't have drug-induced lupus unless you've been told. But these signs and symptoms manifest just the same way as SLE. So it includes the joint pain, muscle pain, arthritis, flu-like symptoms, inflammation that's happening. But once again, once the medication is stopped, and it takes about 6 months for that medication to fully leave the system and for the immune system to start feeling back to normal. But the way that we treat it is pretty much the same way we treat SLE. There are we're running the tests, the DNA markers to see if this is the culprit. We treat and discontinue the offending medication with the use of NSAIDs and immunosuppressants. Typically, the symptoms, like I said, will disappear after 6 months. Okay, so we typically say, is this a true form of lupus or is this not? You know, is there something active in is there something in the immune system that's activated by the medication? And that's what's happening here. So neonatal lupus. Neonatal lupus, again, is not a true form of lupus because you can't pass lupus from mother to baby. But what's actually happening here is that moms that give birth, babies have mom's immune system for the first 6 months of life. And so baby has mom's immunity and they start building up their own immunity gradually. They may have little signs and symptoms such as rashes that come out. But at birth, it's not passed through the umbilical cord or anything like that. It could be something active in the immune system, maybe later on down the line, but it's not given from mom to baby, initially at birth or anything like that. It's not contagious. Lupus is not a contagious disease. But unfortunately, what we see in 2 to 3% of cases with moms that are pregnant is low fetal heart rate. And so that is definitely caught early on. And I just want to say, moms that are pregnant and have lupus or want to become pregnant, you can have a baby, or you can have a successful pregnancy. It is just considered that a lupus patient is a high-risk pregnancy. So what does that really mean? It means that additional physicians need to follow after you and look to make sure that you have the most prime pregnancy and that you're prepared. And what we like to see, or physicians like to see, is that a patient is in remission for at least a year before conceiving a child. So number one thing, if you want to start a family, is family planning. That's really what the most important part of if you're looking to start a family or conceive a child. So again, about 2 to 3% of cases, some babies have a congenital heart block, congenital heart anomaly. And what actually has happened is after the baby's born, mom's typically on bed rest, but once the baby's born, they have a heart surgery after birth. And again, I said that moms with lupus are considered high risk, and so that just means extra physicians and specialists will be following mom and baby. So here we go. What kinds of doctors treat lupus patients? This is the big one, right? If there's any lupus patients out there, you know that you're typically seeing a big array of physicians. And unfortunately, that is what's necessary. So developing a good patient-physician relationship between you and your doctor is so important. Now, typically, the rheumatologist is the doctor that diagnoses a lupus patient. Sometimes it can come from a general care practitioner, but developing relationships with both is super important because, as we know, rheumatology is a specialized field and it can sometimes be difficult to get in with that rheumatologist. Unfortunately, that's what a lot of patients see. So developing a good relationship with your general care physician to help talk with while you're waiting to see your specialist is very important. But the reality is because lupus can affect any organ, any system in the body. If there are kidney issues, you'd be seeing a kidney specialist. If there's heart issues, you'd be seeing a cardiologist. Skin issues, a dermatologist. And it takes this network of physicians to really help successfully treat a lupus patient. And what's really important here is that when a lupus patient is seeking help with physicians, that you really have your physicians umbrellaed in one system, which is easier said for people that live in larger populations. Here in Ohio, we have great medical systems, but if you're more in a rural setting, maybe you're traveling an hour or 45 minutes to get to your doctor, it's really important that you keep your specialists and all your physicians under one roof. So if you're in Cincinnati, keeping them all in UC is important, or if you're in OSU, keeping them all at OSU together. If you're up here in Cleveland, keeping them all together in Cleveland Clinic, so on and so forth. But keeping all your physicians in one house. And now why we say that is because that medical history follows you. So if you're reporting one system, all these specialists can see what's happening under your chart. So that's very important to think about, okay? If you need help about talking about how do you seek medical treatment or who to go to, we have trained patient navigators within our office to help talk to you and help navigate you through the right pathway on how do you know if you're in the best hands possible. Along with that said, we have a resource guide, and that resource guide is used to help patients in finding the proper doctor for them. So lupus and pregnancy, we did mention that it's considered high risk. Family planning is what's necessary. Remission at the time of conception is very important. Certain risk factors can increase chances of poor fetal outcomes. So of course you don't want to be in a flare because you can't be on all the medications that you would typically be on. I do believe Plaquenil is an actual a medication that's okay to be on while pregnant. So again, that's a treatment course that you have to talk about with your physician. Your physician is the proper source of treatment and your plan. So keep that in mind. It is possible to get pregnant with lupus and no complications. I know many women that have very successful pregnancies. And patients, again, should be closely monitored by their periodontologist and rheumatologist. So lupus flares in remission. Now, we should really depict on what a lupus flare is. A lupus flare is when the disease activity is at a heightened peak, right? And the goal for every lupus patient, like we said, is to find remission, to keep it at bay. And we know we're in remission when we're 100% symptom-free. There is no pain, there is no fatigue. And one of the important things that we need to teach lupus patients is when to call the physician. And when you should call your physician is when there is a change in your disease activity. And that's what's important, and to know your body. So you really have to understand your body and what's going on. Most patients do kind of have a sense of something's not right or something's on key, right? And so having that open relationship with the physician is very important. So this is actually my favorite part of the presentation, lifestyle changes for living better with lupus. You know, we always talk about what not to do, what to do, and things of that nature. But what are some good, healthy things that we can do? Lifestyle changes, right? How to live better, exercise. I think I talked about briefly just stretching. You know, it doesn't have to be run a marathon or do a 6-hour Zumbathon with us. We do host Zumbathons, but by all means, you don't have to, you know, Zumba for however long the program is, and it's never been 6 hours. But anyhow, exercise is super important. Simple stretching, getting blood flow going. You know, not a high impact exercise, maybe swimming. If hair issues are something, or skin issues are an issue, maybe light walking. But honestly, light stretching and just getting moving is important. And if you're ready for some change and an exercise regimen is in order for you, talking with your physicians about possibly meeting with physical therapists that can help design a program appropriate for you. Ultraviolet light and fluorescent light, we need to know to take precautions to minimize exposure, because yes, fluorescent lights do omit a UV light range and can affect some lupus patients. Perhaps you weren't, you know, fluorescent light bulbs aren't really a thing at home anymore. Maybe that's more in a factory setting. I know in our office we do have fluorescent lights, but we have film coverings over the top of it that protect that UV protection. So making sure that there's proper lenses there. A hot topic here, typically for lupus patients, that we all want to know, what type of diet should a lupus patient on? I think we're all, we want to know what we're putting into our body, right? So what diets and supplements are good? Truthfully, there are no one lupus diet. There is no one lupus diet. But we've done many, many chats with physicians from across the state of Ohio, and the general consensus is that, you know, an overall healthy diet is what's recommended, and a great diet to be on is the Mediterranean diet, and that's a diet that's high in lean meats and proteins, so fish and poultry are great, but the general consensus of a Mediterranean diet is a diet that's high in vegetables and fruit. And so, you know, this is something that's been recommended from dietitians and from other physicians. But again, there is no one lupus diet for a patient to be on. I know some patients go on gluten-free diets because perhaps maybe gluten is an irritant for them, but it doesn't necessarily mean it affects someone else. So just a general overall healthy diet is what's recommended. A lot of patients do clean eating too. These are things that patients can do that you can try to see if you feel better on after changing your diet. Smoking, we talked about that. It's a bad habit, eliminate it. It can actually affect the medication, so you definitely want to be cognizant of that. And joining perhaps a class to quit smoking is necessary. So sleep and rest, oh my goodness. We all love a good sleep, right? A good nap in the middle of the day. But what I'm talking about for lupus patients is patients that are suffering from extreme fatigue. This is debilitating fatigue. And if a patient is rushing home to jump into bed to get in bed because they've had a long day and they just can't function anymore, something needs to change. You know, you shouldn't be needing to rush home to get into bed right away and then to sleep and then just to do this all over again, right? So it's super important to prepare your body for mind and rest. So that means having a routine, right? And coming home, perhaps you get home from work or whatnot, and I know it's a whole different setting now, but So maybe we're all at home, but not just being done, when it's done working, you clocked out from working from home and you're just running to bed, right? We don't want to do that anymore. You have to figure out a better sleep pattern. So perhaps it's making lunch for the next day or preparing your dinner, taking those small steps to get ready for bed, washing our face, having that hygiene routine, getting your pajamas on and then getting into bed. I guess what I'm saying is if you're rushing to get into bed, something needs to change. Physician's orders. This is very important. And a lot of the time, physicians say that it's difficult for patients to follow recommendations from physicians. If this is the case, talk to your physician. Always follow the recommendations of your physician, what they're saying to you, how to take the medications, what to avoid. You and your doctor have to build that relationship so that you have this open, honest feedback so that you can both be on the same plan. For instance, if you're taking a medication but not able to keep up with the course of regimen that it's been prescribed, a physician may be thinking that you're taking this medication every day or maybe twice a day at a specific time, and maybe you can't keep up with it. Maybe there's something in the day that you have a meeting in the middle of the day that hinders you from taking your medication on time. You need to readjust the plan and make sure that you can follow the recommendations or make changes so that you can get it in order. So medications, taking it as prescribed. Again, communicating that with your physician. And if you're having any side effects of the medication, again, reiterating what's happening, because it could be simply just readjusting the dose to get you back on track. Coping measures. These are all great things, controlling your fatigue, learning to pace your activity. So one of the things that I'm super mindful of is we are all so busy, and maybe you have a lot of screen time with your computer. Your eyes can get fatigued, or you're working from home, or maybe you're out there. Maybe you're still needing to work, but pacing your activity. I think it's important just to be mindful to unplug from all of life's stressors for just maybe 10 minutes a day. Easier said than done, super simple and sounds silly, but I'll tell you, if you can start just being super mindful of what you have going on and eliminating the stress in the middle of the day, it can really help pace that fatigue by the end of the day. So what I typically tell patients is if they can go to a space where they can be uninterrupted on their break, set a reminder on your phone to ring or tell a friend that you're going to, just take some personal time and to call you, maybe go to your car, set your timer on and just relax. And I'm simply saying, take out all distractions and kind of just digress, push all the pain out of your body, push the stress out of your body, and learning to pace that activity to control stress and fatigue. If you're under a lot of stress, we have to manage that. Stress can be, I believe, could be, maybe the #1 trigger for a lupus flare. It definitely affects the body and it takes a toll. And repeated stress can lead you into a really big flare. Along the lines of stress, managing depression. Many lupus patients are unfortunately depressed. This can be fixed. You have to talk with your physician about it. Depression is a chemical imbalance and can be fixed with the right medications. So if you're having depressive thoughts, please talk to your physicians or call the office to have us help you to have that conversation, prep you to have that conversation with your physician. Managing anger. Don't let your feelings bottle up. And so what I typically say here is, if you get angry, everyone gets a little ticked off now and then, right? But if it's a consecutive thing and you're not learning how to displace this anger or this energy, it'll build up like a pop bottle. When you shake a pop bottle, that fizz builds up, that pressure builds up. You shake it some more, you shake it some more. Well, what's bound to happen is everything's going to explode and everyone's going to get pop on them. And ultimately, no one's going to feel any better, right? So learning how to manage those angers and stresses. Sometimes many lupus patients can feel like things have changed for them. Maybe they're not able to keep up with the activities that they used to. And so these stress, these fatigues, these angers all build up. The depression adds up. So how do you cope with this? What do you do? We like to think that you can turn to the Lupus Foundation because we are here for you. We have many local support groups throughout the state of Ohio. And if you're catching this and you're not in the state of Ohio, many support groups throughout the US that can help you. The state of Ohio has patient navigators trained and ready to help you with your journey with lupus. And so support group has different meanings for everybody. But if you're not knowing how to deal with your feelings or emotions, you could talk with someone that understands. Connect with other lupus patients to see what they're going through and how they best managed it. We have a saying in our office that you will learn the most from other lupus patients than you will from any other book or any other resource. And the reality is because a lupus patient has gone through it and they understand. And so we gather support groups throughout the state, and I highly encourage you to jump in and get involved. Another thing that you can do with coping measures is be more active with your local chapter. You know, right now is unprecedented times, but we're constantly trying to think of ways to connect with you. And taking the time today to just let you know, lupus classes like this exist on a monthly, weekly basis. If anyone's looking to do a one-on-one session with me, maybe you want to have your family come in and do a meeting with me so that they can be better educated on lupus, I'd be happy to do that with you. Get involved with your local chapter. There's a lot of advocacy, education, and support that's happening. Continuing on coping measures, resolving guilt. You know, it's going along the lines of what I was saying before. Perhaps you feel guilty. Maybe before you could clean the whole house on a Saturday morning, top to bottom, and no questions said and done, and then you could go out with your friends at the end of the night. You know, it doesn't mean, you know, that could have guilt that maybe you overdid it and you had to cancel plans with your friends. Real friends will understand, right? But you shouldn't let that guilt harbor within you. So instead of cleaning the whole house top to bottom, maybe just clean one room at a time so that you can still manage and have enough energy to spend time with the family and friends you want to later that day. Addressing workplace issues, discuss it with your employer. So the one thing for lupus patients is that lupus patients are covered through the American Disability Act. So that's something that you could talk with your HR company about. You know, I talked about maybe you need a 10-minute break to take your medications and de-stress and do some meditations, or, you know, whatever you want to use that time frame for. That's something you could talk about with your HR employer, that your workplace can make accommodations for you. Now, these are reasonable accommodations, right? Reasonable accommodations that you can talk to, that in order for you to perform your job to the best of your ability, maybe you need that 10-minute additional break to help you take your medications or do something. So definitely talk to your HR company about that. Addressing sexuality issues, this is important. We don't want to hide from any issues. If we're developing sexuality issues, we want to be able to discuss it with our partner and perhaps seek medical advice on how you can work past these things. It's not something that you want to be quiet about because your significant other or yourself might feel that there's something wrong, and there's not. You're just going through different emotions, and the only way to address it is to hit it straight on and have the conversation about what's happening. And again, I'm a big advocate about good patient-physician relationship. You know you have a great doctor when you have someone who's open, honest, and responsive, right? So you want to be able to open that line of communication with your physician. Super important to have a great doctor-patient relationship. And remember, that's a two-way street, right? If you, again, you need help with, if you're a new patient and you don't have a rheumatologist yet, we do have a resource guide for you to help you out with that. So the prognosis for lupus ranges from mild to life-threatening. Again, lupus is life-threatening when lupus attacks the major organs like the heart, kidney, lungs. But the majority of people can look forward to a normal, healthy life with lupus. It's about getting on the right medications, seeing the right physicians, and making the right lifestyle changes. So death from lupus is uncommon. And like I said, it typically happens when lupus is affecting the major organs in the body. Something we're very proud about with the LFA is the research programs that we have nationally. Our organization takes a three-pronged approach to this. We support education, advocacy, and research. There are many local research that's happening in the state of Ohio and actually across the US. And this is great. We're making great strides. I'd say over the last 10 years, more people are hearing about lupus, but are still confused about it. And that's what we fight for every day, is that we need better research out there for lupus patients to help treat and close that window gap of a 6-year diagnosis timeframe for patients waiting 6 years for proper diagnosis. And the only way that we'll get there is ensuring that the proper research is being done. 1, we need better diagnostic tools. 2, we need better medications. Patients deserve an arsenal of medications to combat the disease activity that's going on in their body. And the only way we can do that is coming together and advocating for lupus patients' rights. We have many community agencies and resources for you to get involved with. One of the popular programs that we provide is the educational programs called Ask the Expert series. This is where we gather our nation's leading experts on specific topics and have them give a presentation to us, where you can go ahead and submit questions ahead of time. And during that call-in group, your questions will be answered. Our latest resource that we currently have is on the front page of our website, and I'll just navigate to there right now. So if you visit lupusgreaterohio.org, you'll come to our website. And in light of everything, we find it important to bring you always the latest, most accurate, up-to-date information on lupus. And right now, as we are all hyper-focused on the coronavirus, we have a news section here for you for resources on COVID-19. I encourage all of you to visit our website and check out the resources that we have available to you. We update these resources quite frequently. As we get them, we provide you with the links right here. So highly encourage you guys to use this resource that's available to you. So other community agencies that we work with, or resources that we have available to you, as always, are the support groups and events and fundraising and advocacy efforts that we host. Again, if you navigate to our chapter website, you will see the latest program that we will be providing you will be a webinar. It is our virtual summit. Please join us for the part 1 of post-COVID-19, the stay-at-home order. On Saturday, May 16th, we will be hosting a summit with university hospitals physicians. And if you go to our website, you can go ahead and register for it here. So again, a virtual summit. We're constantly trying to find ways to update and bring you the latest, most accurate, up-to-date information. And we're going to do that by a webinar. And you'll see our list of panelists that will be speaking there. I highly encourage you to attend. So back to our presentation here, other community resources. Health insurance is always a big thing for lupus patients. It can be difficult to have coverage just getting health insurance through work. So many patients rely on government-related services, but the link here to Medicare and healthcare.gov to help out with that. Financial assistance programs can be found on lupus.org, or you can navigate to the website always to see if there's any assistance that we can help with. Social Security, the contact information's there, disability. United Way 211 is a great local resource for us here. We can help navigate you and to see if there's help with electric bills or gas bills. There are some resources local to Ohio. And then clinicaltrial.gov, if you're interested in just studying or looking for clinical trials that are happening. I believe here in the state of Ohio, we have about 23 active lupus research programs going on, which is excellent. Nationwide, there's much more. But if you're interested there, you could actually go to lupusgreaterohio.org and look for clinical trials. And so let's see our contact information. We are always available to talk with you by phone. If you call at 1-888-NO-LUPUS or visit our website, you can find our contact information there. You can always email us at info@lupusgreaterohio.org. And please follow us on all social media platforms. Facebook is a great way to stay connected with us, our Instagram handle. But yes, so we are always looking for ways to stay connected with you. And here is a list of our references to the slides that you just saw. So I want to thank you for joining me for the new patient education class. I hope you found this information useful. if anyone is looking to contact me and speak one-on-one, I'd be happy to talk with you. I am your local resource, your local patient navigator with the chapter. We have patient navigators throughout the state if you want to talk with someone specific in your area. But please pick up the phone, 1-888-NO-LUPUS, and ask to talk to Leslie. I'd be happy to talk with you anytime. Well, thanks for joining me and have a great evening. Everyone stay safe and healthy.